few months ago, I shared that my dear wife, Gail, the love of my life, my best friend and soulmate, had advanced uterine cancer. She's doing great. By all testing, Gail seems to be cancer-free. And I'm deeply, deeply grateful. But when we first got the news, before we knew whether surgery would work, before we knew whether the chemo and radiation would work, I was in a state of panic. And I remember thinking, if Gail dies, I might truly die of a broken heart. Now, that sounds a bit melodramatic, but is it? Today, I'm asking whether emotions can actually affect the heart, and why the answer matters, even if most of us will never die from one moment of Welcome, my N of One Nation, and my dear listeners, to episode number 73. Can you die of a broken heart? Or be scared to death? Folks often say, I'm heartbroken. I have a heavy heart. I was so scared to death. Or I was so angry, I almost had a heart attack. Today's episode asks whether those phrases are just that, phrases, or whether grief, fear, anger, chronic stress, loneliness, and love can actually affect our heart. Based upon when Gail got ill, I wondered, was this true or was it hyperbole? So, of course, I looked for evidence on both sides of the issue. Here's what I found. Yes, emotions affect the heart. The extreme examples we hear about are rare, but real. But more importantly, these extreme examples led me to look at the not so extreme examples that affect all of us almost all the time. Chronic stress and what it does to our heart. And what might we do to avoid the bad consequences of that stress? That's today's task. And I hope you stay with me on this, emotional roller coaster. I haven't mentioned in a while that I have a regular, of course, free newsletter. If you haven't done so, please sign up. Just go to drbobbyevidence.com. You can also send me a note there. And I love to get notes. And if you haven't shared the podcast recently with your friends, think about who else might benefit from it. On to the topic. Shakespeare wrote in Macbeth, "Give sorrow words. The grief that does not speak whispers the o'er-fraught heart and bids it break." Now, Shakespeare wasn't a cardiologist, but he made an important biologic point. Emotions don't just affect our mind, they influence our body. And for today's discussion, our heart. Let's dive in. Part 1. Can you actually die of a broken heart? Can it happen? Yes. Rare, but yes. The clearest example is called Takotsubo syndrome, also called stress cardiomyopathy or broken heart syndrome. Here's what happens. A person suffers a horrendous loss, shock, or other intense sudden stress. Not long after, the patient develops chest pain and shortness of breath. Doctors may think it's a heart attack, but when they look for a classic blocked artery, they often don't find one. Instead, something has happened to the muscle, the heart muscle itself. The heart's main pumping chamber stops working correctly as it balloons into a distinctive shape. That shape of the heart gave the condition its name, Takotsubo, after a Japanese octopus vessel or urn. The heart actually turns into something that really looks like that. I've included a link to an image of it. The New England Journal of Medicine published a study with 1,750 patients who had Takotsubo syndrome. Patients had acute heart failure with complications, including death. Death for patients hospitalized with a broken heart was as likely as those hospitalized with a classic heart attack. Now, to add some nuance here, Takotsubo is not always caused by grief. Physical stress, surgery, severe illness, neurologic events can also trigger it. So, broken heart syndrome is a memorable name, but the condition is broader than just heartbreak. The reason I started with this syndrome is that although rare, it proves the concept. Emotion and stress can affect our heart. Dying of a broken heart isn't just a metaphor for profound grief. Adding to this topic about grief and the heart, there are many studies showing that when one spouse dies, there is a 40 to 70% increased likelihood that the surviving spouse will die in the next few months. Men, we are more at risk. Now that's a whole topic for another day and another podcast. In one study, if our wife dies, our risk of death jumps 70%. Now for women, their risk increases too, but only a 25% elevation. So my concern about my health, if Gail died, wasn't just idle fear. There's evidence to support it. Next, can you be frightened to death? Here again, the answer is yes. Rarely, but most likely in someone with an already vulnerable heart. Here's how the story goes. A sudden traumatic event, a robbery, a horrible accident, an earthquake, or hearing devastating news. For most of us, most of the time, our system handles it. But in a vulnerable person, fear can lead to a dangerous heart rhythm or coronary spasm. Here's the potential biology. Fear activates the sympathetic nervous system. Adrenaline and other hormones increase our heart rate, blood pressure, vascular tone, and electrical excitability. And a cardiac event can occur. That doesn't mean fear is often fatal. It means fear can act as a trigger. I mentioned earthquakes. A classic New England Journal of Medicine study looked at what happened at the time of the 1994 Northridge earthquake in Los Angeles. I was there when it happened. It was big and it was memorable. Many people were really scared. The study found that the earthquake was associated with a large increase in sudden death due to cardiac causes. On a typical day in LA County, 4 people die of a sudden cardiac event. And the day after the earthquake, 24 people died. A lot more. So scared to death? Likely. Let's now move from fear to anger. Third, can anger trigger a heart attack? A horrible argument, road rage, a fight with a family member, your heart pounds, your blood pressure rises. Can this cause a heart attack? Yes, sometimes. Now, anger doesn't create that heart disease in the moment, but it can briefly increase the risk of a cardiovascular event. If someone with heart disease has a vulnerable plaque or rhythm instability, that short-term surge of anger may matter. What about the evidence? In a systematic review titled Outbursts of Anger as a trigger of acute cardiovascular events. The authors looked at anger outbursts as triggers for acute events, including heart attack, stroke, or ventricular arrhythmias. The study found that anger outbursts were associated with higher cardiovascular risk shortly afterwards. Let's put this into proper perspective. The risk for a healthy person after one angry episode is really low. The risk may become more meaningful for people with known heart disease. As the saying goes, anger may not build the bomb, but in a vulnerable person, it may light the fuse. Let's now move from sudden emotional events to something a lot more common: day-to-day stress. Part 2, chronic stress. Okay, most grief doesn't cause broken heart syndrome, and most fear or anger doesn't cause a heart attack. But these extreme cases show us something important. Emotion can affect our nervous system and cause surges of adrenaline, cortisol, or blood pressure. And those pathways happen not just on your worst day. They may also be activated repeatedly over years. And over time, that small damage can be damaging. For most of us, the question isn't, will one terrible moment break my heart? The more relevant question is, what is the cumulative effect of chronic stress, poor sleep, loneliness, depression, anxiety, or anger? An important meta-analysis called Perceived Stress and Coronary Heart Disease found that high perceived stress was associated with a moderately increased risk of coronary heart disease. In another study, researchers looked at folks who had a first heart attack and compared them with similar folks who didn't have one. They found that work stress, home stress, financial stress, stressful life events, and low sense of control were associated with a significantly increased heart attack risk. And finally, a meta-analysis, including more than 600,000 people, found that psychological distress was associated with a 28% increase risk of a heart event. Putting things into perspective, stress is not as powerful a cardiac risk factor as smoking, hypertension, or diabetes. But stress is common. And being common, it matters for many of us. So how might this happen? Chronic stress can directly increase our heart rate, our blood pressure, our cortisol levels, and our sympathetic nervous system tone. And those are known problems for our heart. Stress can also lead us to exercise less, drink more alcohol, sleep worse, eat differently, or withdraw socially. And these changes in behavior can affect our heart over time. In an earlier episode called Stressed Out, I talked about chronic stress as really a mismatch between demands we perceive we have and our perception of what resources we have to handle those demands. So more demands than we can handle. I also discussed how to measure stress with tools like the perceived stress scale or resting heart rate or heart rate variability. Take a listen to the episode if you want to learn more. In that discussion, I also shared evidence for what does and doesn't work to deal with the stress. What helps? Better sleep, exercise, breath work, and meditation. And surprising to me, there was evidence to support music therapy and aromatherapy with lavender. Earlier, I mentioned that when a spouse dies, the remaining one has a higher likelihood of dying soon thereafter. But relationships matter more than just suddenly losing a partner. Many many studies have shown that people with good social connections live longer. Now, we don't know for sure why this occurs, but it may be that having others close to us in life helps our stress. It's been theorized that these relationships encourages us to take care of ourselves more, sleep better, move more, take our medications, go to the doctor when problems arise. But that sounds a bit theoretical for me. Let's look for some evidence. In a large meta-analysis of 148 studies, the researchers found that people with stronger social relationships had a 50% better chance of survival compared with people with weaker ones. And the opposite is also true. Loneliness is a problem. A meta-analysis found that having poor social relationships was associated with increased risk of coronary heart disease and stroke. Let's begin to wrap up. So, can you die of a broken heart? Rarely, yes. Can you be frightened to death? Rarely, but yes. Can anger trigger a heart attack? Sometimes, especially in a vulnerable person. But for most of us, the bigger question is not whether one terrible emotion will kill us. It's whether our lives regularly place our heart under stress. The heart may be a pump, but a pump that seems to be influenced by what happens to us emotionally. Sure, the extreme cases get our attention, but chronic and more subtle stress likely is what will affect us most. I want you all to live long and well. Keep in mind, the heart beats inside our body, but it's influenced by our whole life. Please take care of yourself, your heart, and those whom you love. I'll try to do the same. My podcast is one way I hope that I'm helping you. I know that it helps me too, and I thoroughly enjoy it.